Thousands of people across the UK rely on vital support from home care services, but many of these services are at risk of closure, partly because of the extra financial cost of the pandemic. The sector as a whole reportedly has more than £100 million of debt, with more than a quarter of home care businesses at risk of going out of business. Sam Fennick reports.
When I wake up every morning, you do wonder what's going to happen today. There's never been an easy day since he locked us down. Every day's a battle.
Katie has a long day ahead of her. She'll visit more than 12 people.
Morning, John.
Helping them to dress, organising their food.
OK, have a seat.
And making sure they've all had their medication. We gave her a camera so that she can film her visits.
Is that comfy?
John is nearly 90. A year ago he fell and now struggles to walk. Katie helps him with everyday chores. For John, these carers allow him to stay at home in the house he's lived in for 70 years.
It's all very relaxing and very family treatment, so you don't feel uncomfortable. And in your own house, well, that's where your memories and happiness are. This good lady here, I feel she's like one of the family to me.
After 20 minutes with John, Katie's on to her next visit.
So now we're off to see Mr. Mannion. He lives in the Western area. He's unfortunately very ill, terminally ill, and it's very important for him and his family to keep him at home as long as possible.
All the people Katie cares for have different needs. There's end-of-life care, and there's people like Phil. Phil won't see anyone other than his carers today.
I mean, without them, I probably would feel lonely. Well, the carers will make sure that I've got everything I need, and then they come back in the afternoon to give me my lunch.
More than 500,000 people in the UK receive care at home. 80% of this is funded by local authorities, and each authority pays a different amount for care. Exclusive research for the BBC suggests more than a quarter of UK home care providers are now at risk of going out of business. They say it's because they don't get enough money from councils, and now there are additional costs because of COVID. Each operator has, on average, £38,000 worth of debt. Knowsley Council pays one of the lowest rates.
You're constantly working on a knife edge to ensure that not only can you provide that quality service, which is paramount, but also that you've got that financial support to keep the business running.
And where are the main costs for you of this pandemic?
I would say at the moment, I think within this second wave, we're seeing a lot higher rate of absence.
Ready?
Knowsley Council says the price they pay for care increased by 7% in April. They say it's costing them more than £400,000 a year. They're also helping businesses cover the cost of staff who are off sick or having to isolate because of COVID. At 7 o'clock, Katie starts her evening calls. She'll work right through until 10:30 tonight.
Come on, move up, please.
Harry's just celebrated his 20th birthday. He lives in Widnes with his mum and dad and younger brother and sister.
We can't go under it.
He isn't palliative care or anything like that. His call is a bit of independence for Harry himself.
Harry needs it for his mental well-being. When they don't come, it's very hard keeping Harry's spirits lifted. They're like his friends, they're not just his carers.
As the evening progresses, Katie's calls start to slip, and by 9 o'clock she's already running half an hour behind.
We don't really get travel time, so trying to get here on time sometimes is a problem.
The government in England says it's committed to finding a long-term solution for social care that puts the sector on a sustainable footing for the future. In the meantime, it's made £4.5 billion available to local authorities to help deal with the pandemic.
I'm absolutely shattered. I'm done in. Back again at it tomorrow, 7 a.m. So I think it's time to go in and get some sleep.
Well, we can speak now more about this story, talking to Colin Angel, who's Policy Director of the UK Homecare Association, and also to Rob Greedy, who is the founder and manager of Eclipse Homecare. Colin and Rob, thank you very much for joining us to talk about this today. Rob, I'll begin with you. Just tell us a bit, first of all, about your business, how many people you employ and the sort of services you provide.
Well, good morning. Yes, we employ about 300 staff. We care for something like over 400 people out in the community. We're providing the sort of home care services that your clip was just showing. And these are the most vulnerable people in our society. Most of our clients are elderly, so they're in their 80s, their 90s, and many of them simply cannot manage without the care and support that we're able to offer them on a daily basis. It's been extremely challenging. We have a fantastic team of staff who've gone over and beyond and really done a fantastic job out there. But of course, everybody is anxious. So I heard someone saying high levels of absence. Yes, we had high levels of absence in the first wave, and I'm extremely worried that we will also have high levels of absence again now, as people are required to shield from COVID and so on. So it's really challenging because of COVID. Challenges, of course, before then, but exacerbated by COVID. Exactly.
Colin, sorry, Rob, I was just going to ask Colin if this is a familiar story.
It's a regrettably extremely familiar story. The living life on a knife edge, as Paul described in the video, is exactly how organisations describe it. And really, we need care providers focusing on delivering fantastic care during a pandemic, not worrying about money and the accessibility of personal protective equipment, which has been one of the biggest exacerbators to an already weak financial system in social care.
And the BBC research suggests that a quarter of home care providers could go out of business. How close are these providers to that point in your estimation?
Well, some of them are extremely close and are looking at their finances very carefully. I think what we need to be clear is that organisations which may exit the sector will likely do so in an organised way. So this won't be organisations just disappearing overnight. But actually what that means is there will be fewer care providers available to deliver care. And all the people that are looking for care and support will probably end up waiting longer before that care can start. And where that will really hit is in the NHS, fewer people able to get out of hospital quickly, and that has a backlog on the NHS as well.
I mean, that's really concerning for the people who need that care. I mean, you're saying, yes, if carers go out of business, home care providers go out of business, it will be in an organised fashion, but that creates huge worries for the elderly people who depend on them. Rob, just coming back to the fact that home care providers were already in difficulties before the pandemic hit, just talk to us about what was going on financially there, because I know that in your instance, it was not exactly, well, I think it was loss-making, wasn't it, to provide care for every council client, and these council clients were effectively being subsidised by private work. Is that right?
That's absolutely right. In our case, prior to the pandemic, we reckoned we were, well, we didn't reckon, we knew we were losing about 72 pence an hour for every state-funded, local authority-funded client. I can tell you that that's increased to something approaching £1.40 now, with all of the extra costs coming through. And you're absolutely right. In our case, we've only been able to survive because we've got a very healthy self-funded market. So there is cross-subsidisation, and that is absolutely commonplace across the sector, and it's absolutely wrong because it does put us under tremendous financial pressure. And if you add to that the fact that there's been actually a decrease in demand, as some people who actually do need care have been understandably saying, well, look, we really don't want you just at the moment. And, you know, maybe they're frightened.
Yeah, they're frightened, obviously, of having people coming into their homes, which is a terrible position to be in. I mean, Colin, just picking up on that, obviously throughout this pandemic, we've heard calls for, home care workers to be paid higher wages, and if you add that into the financial demands, the financial pressures that Rob is talking about there, we can see that the sector as a whole really needs to be examined carefully, how it's funded, how it's working. There was talk, wasn't there, of a green paper on sustainability for social care before the election, the last election. What's happening with that?
Well, who knows what's happened to that green paper? It's certainly not appeared anytime soon. I have very little confidence that there is a genuinely worked up plan. But I think it's really important that, as well as thinking about that green paper, government has already legislated for the way that councils should behave in England, and that's in the Care Act 2014. And actually, what government hasn't done is really keep a handle on whether councils are actually complying with the law that is already there. And that's something I think is really important.
OK, well, gosh, we could talk more and more about this, but we are out of time. And thank you very much for giving us, some detail on what the situation is in the home care sector. Colin Angel, the Policy Director for the UK Home Care Association, and Rob Greedy from Eclipse Home Care. Thank you both very much. And let me just tell you that you can hear more on this story on Radio 4's You and Yours today at 12:20 p.m.